chemotherapy for recurrent or metastatic disease. The combination of cisplatin/5-FU produces overall response rates of approximately 30% and survival rates of 6 months. In randomized trials comparing this combination with single-agent cisplatin, 5-FU, or methotrexate, response rates with the single agents are lower, but survival is equivalent. However, because many practitioners believe response is a surrogate for palliation, cisplatin/5-FU has been used widely in this setting. The taxanes are the most active cytotoxins yet identified in head and neck cancer, with overall response rates of approximately 35% in patients with recurrent or incurable disease. In one randomized trial, the combination of Paclitaxel, cisplatin was compared with cisplatin/5-FU in patients with recurrent disease. A total of 194 patients who were therapy naive for recurrent disease with an ECOG performance status of 0 to 1 were randomized. Efficacy outcomes were similar in the two arms, with median survival rates of 8 and 9 months for Paclitaxel, cisplatin compared with cisplatin/5-FU, respectively. Paclitaxel, cisplatin was less toxic and more convenient, representing an effective and safe alternative to the traditional 5-FU containing regimen. Based on nearly universal expression of EGFR in squamous cell cancer of the head and neck, EGFR-targeted agents have been evaluated in patients with recurrent disease. Although the single-agent response rates of the monoclonal antibody cetuximab and the tyrosine kinase inhibitors erlotinib and gefitinib in this setting are only in the range of 5% to 15%, their use in combination with chemotherapy, particularly cetuximab, holds more promise. Results of the EXTREME Erbitux in first-line treatment of recurrent or metastatic head and neck cancer trial, which accrued 442 patients with recurrent or metastatic squamous cell cancer of the head and neck, showed that when compared with platinum-based chemotherapy alone, the combination with cetuximab improved median 7.4 months versus 10.1 months, and 1 year, 31% versus 39%, survival rates, with an HR of 0.8, p equals 0.036. Similar promising, albeit preliminary, results have been reported from Phase 2, single-arm studies of cetuximab, Paclitaxel and erlotinib/docetaxel/cisplatin. In addition, cetuximab has modest single-agent activity in the second-line setting after platinum therapy. Data from the Lux Head and Neck 1 study reported in 2014 indicated a significant, yet modest, improvement in progression-free survival for patients treated with the EGFR and HER2, human epidermal growth factor 2, inhibitor, afatinib, compared with methotrexate. Overall, these observations lend impetus to further investigation of EGFR-targeted therapy in combination with neoadjuvant chemotherapy and with chemoradiation therapy in patients with curable disease. Similar to the increased response to treatment noted for patients with locally advanced disease undergoing curative treatment, an analysis of two ECOG studies, E1395 and E3301, by Mira et al. Indicates that patients with HPV-positive disease have a higher response rate and higher overall survival when treated with palliative cytotoxic therapy. As in other solid tumors, there is considerable interest in the activity of immune checkpoint PD-1, programmed cell death 1, inhibitors, such as pembrolizumab, in patients with advanced squamous cell carcinoma of the head and neck. Data presented at the 2014 and 2015 meetings of ASCO showed single-agent activity in a fraction of recurrent tumors. Second and third-line studies are underway. Photodynamic therapy. Photodynamic therapy may have some promise in the treatment of mucosal dysplasia and small head and neck tumors. Small studies of photodynamic therapy, performed at several institutions, suggest that widespread areas of carcinoma in situ or severe dysplasia, as well as cancer, are often extirpated after photodynamic therapy. Some patients have experienced durable remissions, but the long-term efficacy of this modality remains uncertain. Pulsed dye laser therapy for early laryngeal lesions. The pulsed dye laser initially used to treat vascular lesions has recently been investigated in the treatment of respiratory papillomatosis, dysplastic cancers, and early invasive glottic carcinomas. The efficacy of the laser is mediated through its antaneogenic properties. The non-toxic treatment preserves the laryngeal microarchitecture and preserves or restores near-normal vocal quality. In addition, this modality can be used in an outpatient clinic setting. Preliminary findings are favorable. At this time, however, pulsed dye laser therapy should be considered investigational. Chemoprevention. The area of chemoprevention has received a great deal of attention, and the concept of field cancerization is important in this context. As mentioned previously, this concept refers to the diffuse epithelial injury incurred by upper digestive tract mucosa due to chronic exposure to carcinogens, most commonly, alcohol and tobacco. These mucosal changes increase the risk of developing premalignant lesions, leukoplakia and erythroplakia, as well as multiple primary lesions. Retinoids, vitamin A analogs, have been investigated as chemopreventive agents in the redigestive tract based on their efficacy in tumor models, such as the hamster buccal pouch. Retinoids mediate changes in gene expression through interaction with nuclear retinoic acid receptors, which function as transcription factors. Nutritional epidemiology studies also have indicated that low serum levels of both carotenoids and retinoids contribute to the risk of cancer development in the epithelium of the upper digestive tract. The role of retinoids in the prevention of second primary tumors in patients treated with curative intent for an early-stage index squamous cell cancer of the head and neck has been investigated in 3 randomized trials. The initial study was a small, single-center, Phase 3 trial of cis-retinoic acid, 1 to 2 mg/kg/d, by Hong et al. Although this study demonstrated decreased second primary tumors in the experimental arm, compliance and morbidity with this high dose were problematic. A second study using a low dose of cis-retinoic acid, 10 mg/d, was performed by ECOG, and results were negative. A third, large, multi-center trial with an intermediate dose of 30 mg/d has also reported negative results in regard to second primary prevention. Rehabilitation. Rehabilitation also is very important in the care of patients with head and neck cancer. It includes physical and occupational therapy, speech and swallowing rehabilitation, and nutritional support. For example, resection of the spinal accessory nerve, which innervates the trapezius muscle, leads to scapular winging, an inability to abduct the arm fully and, eventually, severe pain around the shoulder. These symptoms may be ameliorated with appropriate physical therapy. Adapting to the loss of the larynx also requires intensive rehabilitation and patient motivation. Voice rehabilitation options include esophageal speech, artificial larynges, portable, battery-operated devices, and tracheoesophageal shunts. Patients who undergo non-surgical treatment also benefit from early swallowing rehabilitation. Intensive chemoradiation protocols has been associated with prolonged feeding tube dependence in 20% of patients, although IMRT planning can diminish this number. Early swallowing therapy improves treatment-related dysphagia. Nutritional support is facilitated by temporary nasoduodenal tubes or gastrostomy tubes, which impose added morbidity but are more socially acceptable and ease the patient's transition to normal activities.